the Christmas period, the NHS says there's real pressure on hospitals across the country because of coronavirus. The number of patients being treated is nearing levels last seen in April. Paramedics in London are dealing or have dealt with nearly 8,000 call-outs in a day. To give you some kind of context, that's about 45% more than normal. In Wales, One Health Board are urgently asking students to help manage the number of patients needed for treatment. Let's get a view. Joining me live, delighted to say, is Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter. Thank you for your time. Merry Christmas to you, Doctor.
Good morning to you all. Good morning.
So let's touch on what I just mentioned there. A real big spike on Christmas Day of paramedics being called out on the 999 system for people having concerns about coronavirus.
Yes, so I have seen this rising trend for quite a few weeks now. And, in conversations with clinical commissioning groups, they've all told me that ambulances are having to wait 2, 3, 4, and sometimes even 6 hours just to transfer the patient into the hospital. So we've had this pressure upon the NHS for quite a few weeks, and it is now increasing more so, and it's more public. But we've been riding this storm for quite a few weeks of difficulty and almost full hospitals.
And it is obviously of great concern when people need to go to hospital if they are suspected of having coronavirus. We've also been seeing the infection rate, the number of people who are testing positive, is on the increase. We've been hearing about the two new variants, which mean it's easier for this virus to transmit. But we were told that in both those cases, it shouldn't lead to hospitalizations and isn't more deadly in its mutation. How do these things tie up together when we are seeing a rise of people going to hospital for coronavirus?
So the number of cases going up is a function of, I think, several parameters. And I think we are trying to not address the big issue, which is people have been out and about, Christmas shopping, interacting in crowded places, crowded indoor places now that it is colder and winter period. And all of those parameters lead to getting infected and a rise in number of cases. It's very easy to start blaming that it must be the new strain because it is more infectious. My answer to that is maybe, but the biggest issue is people out and about interacting with each other, and then they get infected, and then it leads to a rise in number of cases. The good news is that these mutations are not more severe disease causing, as you said. And also the mortality, the people dying after being admitted to hospital, is not as high as it was in the March period. So those are good positive bits of news. But mutations do occur. That's the normal biology of these viruses. And we've got, shall we say, a branch from Nigeria, a branch from South Africa, and of course a branch from Kent in the United Kingdom. All these new variant type branches causing allegedly easier to infect. I personally think it's not necessarily easier to infect, but also a combination of people interacting more so with each other during the colder months.
I wonder what your take is on the situation, the concern for many parents about whether it's a good idea for their child to return to the classroom in the new year. Of course, many had to learn online. Officials from Downing Street and the Department for Education are meeting to confirm later perhaps a staggered opening of secondary schools next month. The majority expected to start the term online, with just the children of key workers and those in year 11 and 13 going back on time. You do read and hear different mixed messages about how much the virus is likely to be transmissible between younger people and so on and so forth. What's your take on this?
So irrespective of the new variant being more infectious, I feel we have not really addressed the school issue because where I have influence in the local authority area, I talk to headmasters every day, and there is considerable stress in the school systems with infectious children and disruption to studies. So we really need to address this issue of how can we continue to educate and at the same time keep the school and the school teachers safe. And if this new variant is more infectious, then the urgency of sorting out how are we going to teach and keep the children safe becomes even more urgent to sort out urgently.
We are all been hearing about the vaccine and the hope of a vaccine being a route out of all of this. We know that there's been the rollout of the Pfizer-BioNTech one. There is hope in the coming hours and days that perhaps the Oxford AstraZeneca vaccine might be green-lighted by the regulators. If it is that a game changer?
Well, it will definitely speed things up. But even with the deployment of the AstraZeneca Oxford vaccine, if we were to immunize 1 million people a week, well, that's 50 weeks to immunize 50 million people. And if the new variant is more infectious, we need to immunize 80% of the UK population. So it's a tall order. And moments before coming online with you, I was just thinking to myself that maybe a superhuman effort, care of the government needs to be made to immunize not 1 million per week, but 2 million people per week, which would then enable us to have immunized our population within 25 weeks rather than 50 weeks.
But logistically, that's a really tough call, isn't it, to produce even the volume of vaccine required?
No, we've got a big call on the AstraZeneca Oxford vaccines. So we had a forward order on them, and by the time you have immunized, in your 10th week, so to speak, other supplies will also be coming online as you carry on with your program. So I wouldn't be worried about shortages of the AstraZeneca Oxford vaccine if and when it is licensed. What we need to do is the logistics and the big deployment program to do immunizations almost on a 24/7 basis.
And we know that more than, at least we're told by the Prime Minister, more than 500,000 people have had the first dose of the BioNTech Pfizer vaccine. From what you're hearing from colleagues around the country, has it proved, successful? Are people accepting the virus and without any complications?
Indeed, yes. I mean, there is a big euphoria with the deployment of the Pfizer BioNTech vaccine, and the sensitive groups, the vulnerable healthcare workers, etc., have been immunized. And really, this is the good thing. Uh, General practitioners have been enabled and been the frontline persons to do this job, and they've done a marvelous job in immunizing lots of people with minimal expense to the nation, compared to the lousy waste of money that we did with centralized testing and contact tracing. So again, I say, invest in primary care, and they will do a great job for the nation.
Thank you very much for sparing the time to speak to us live on a bank holiday in the middle of the Christmas festive break. Always on duty and effect for us in some shape or form on LBC News. Thank you very much, Bharat. Pankhania, Senior Clinical Lecturer at the University of Exeter. Thank you so much. Thank you.
Thank you.